If you frequently experience pain in your low back, kind of off to this side, and then you get that deep throbbing pain through your hip, maybe even zinging down your leg, well, these tips are gonna really help you find the relief that you're looking for. The SI joint or sacroiliac joint is where your pelvis connects into the base of your spine, or basically your sacrum. And right behind the SI joint is where your sciatic nerve runs, and it runs right through your piriformis muscle, which is a really deep muscle way up inside of that hip socket. So it's really common to experience discomfort kind of in all three of those areas. What you need to know about the SI joint is that it was not designed to be wobbly at all. It's not like your hip socket or your knee joint that has a lot of motion. It's designed to be really, really stable with very minimal movement. So your goal with your pelvis, and especially at that part of your low back, is to be as stable as possible without a lot of tipping from side to side, especially when it's acting up and feeling uncomfortable. So a couple things to keep in mind with stability first is that you want to make sure that your pelvis is level as you go about your day. Try to not stand with one hip tipped out to the side, with it tucked under. A lot of us stand with our hips tucked under or arched too far out behind us. You want to stand with your pelvis nice and level. And then while you're walking, make sure that your hips are not wobbling too much from side to side. Even when you sit, try not to sit with one leg crossed over the other. Sit as level as possible without tipping from one side to the other. The more stable and level your pelvis is, the happier that SI joint and your sciatic nerve is going to feel. The second thing you need to know is that strengthening all the muscles around your hip joint is going to provide a lot of long-term relief for the pain that you're experiencing. Let me show you 4 strengthening exercises that you can start doing today that will start to provide you some of that relief. The first exercise is a basic hip hinge. So you're going to stand with your feet a little bit wider than hip width apart, maybe right at hip width apart. Knees are soft, not locked out. So knees are soft. Place your fingertips right on your hip bones. Feel where your hip bones are, and then think about pushing your hip bones back to create a deep hip crease, and then press your hips forward, squeezing your glutes at the top. Make sure you don't overarch, because that will provide a lot of kind of pain right at that SI joint, maybe deep in that hip socket. Just come to neutral and do it again. Make sure that those knees are soft. Press your hip bones back, creating that deep hip crease way back into that hip joint, and then stand back up, straightening back out. So these are just the classic hip hinge. You want to make sure that you're folding over perfectly level, not tipping one way or another. For the next few exercises, come down onto the floor, and the first one is going to be just squeezing the glutes is all you're doing. So laying on your back on the floor, all you're going to focus on is to just squeeze your buns as hard as you can. It might be helpful to do them with your legs extended, but that could possibly hurt your low back, hurt that sciatica, could hurt your SI joint too. So just think about squeezing your glutes really hard, and then releasing, and then do that again. Just trying to create a lot of tension through your glute muscle, and then release. So just doing glute squeezes is another great exercise. And then the third exercise is going to start in that same position. Feet are planted, we're gonna squeeze the glutes first, and then lift the hips up level. Set them back down, squeeze the glutes again, and pick your hips up off the floor. These are basic glute bridges, but it really does help to squeeze the glutes first, so you know that you're using those glutes to help push your hips up, keeping in mind that you want to push those hips up as level as you possibly can. The fourth strengthening exercise you can do is going to be on your side with your heels tucked up behind you. Lay all the way onto your arm. Make sure that this top arm elbow is down on the floor. Keeping this elbow down is going to ensure that as you lift your knee, because we're doing clamshells here, that you don't roll your body backwards, okay? Top knee should be slightly more forward than this bottom knee. So elbow down, top knee forward. We're just gonna pick that top knee up about 5 or 6 inches and set it back down. Pick it up, set it down. You don't wanna lift so high that you feel any pain or too much pressure right at that joint. Just lifting it up and setting it down, exhaling as you lift. The third thing to keep in mind is stretching. When you stretch particular muscles in your hip area, that will provide a significant amount of relief for that sciatica, SI joint pain, piriformis syndrome. So the first stretch you can do is just a classic kneeling hip flexor stretch. The tighter these hip flexor muscles are, the more it's going to pull on your pelvis and create a lot of that deep hip pain on the backside. So to do this exercise or to do this stretch, tuck your tailbone under and press your hip bone forward. You can hold on to a wall for a little bit of stability, a little bit of support. But as you do this exercise, do not just dump into the stretch. It's really important that you think about tucking your tailbone under and then pressing your hips forward, feeling that stretch right at your hip flexor. The second stretch you can do is actually for your hamstring. I'll show you on this same right leg. So you're gonna be kneeling once again. This is another stretch you can do sitting in a chair. But in this position, your leg is extended out straight in front of you. You're gonna tip your tail out behind you and hinge your chest forward. In this position, you should be feeling the stretch along the backside of that thigh. This is gonna relieve a lot of that tension that's pulling your pelvis on the backside. And in this position, if you rotate your foot in and out, you might even feel a little bit of a gentle pull right in that area that you're experiencing that deep throbbing pain. The third stretch is on your back with your feet up the wall. Plant one foot along the wall and you're going to cross the other leg up and over. Feel free to move yourself closer to the wall or further back depending on how tight you are. But in this position, make sure that your hips sit all the way down to the floor. They should not be tucked up. Hips should sit down. Try to not swivel from one side to the other. Foot is flexed, and in this position, you can press this knee away from you. This figure 4 style stretch, this is magic. You're gonna feel that release deep up in your hip socket. Hold for nice big deep breaths, getting those muscles to just nicely release. So keeping in mind those 3 key points: stability, the stability of your pelvis, making sure it's sitting level, strength, so building up the strength, especially of those glute muscles around your entire hip socket, and stretching, releasing the tension through some of those really key muscles that surround that hip joint. All 3 of those things combined together is going to provide you that relief that you're looking for your sciatic nerve pain, for your deep piriformis syndrome pain, even for that SI joint pain. Be sure to let me know what you thought about this, and if you learned something in the comments below, I would love to hear from you. And until next time, I'll see you soon.